Hi, friends. I'm Nandiman, and one of areas of my interest is health law, and I teach as professor at the National Law School of India University, which probably you might be aware. And today, I have been assigned the task of taking you through the individual's right to health. This is a module which would introduce you to the appreciation level of idea with regard to individuals' right to health and some of the related dynamics. And I would be using, for your kind information, a descriptive and analytical methodology to discuss the topic or continue with the topic. The focus is obviously the India, or we focus upon the Indian jurisdiction, friends. But the underlying principles, what we are going to discuss all through this module, can be used to any jurisdiction or any civilized society if you wish, because by and large, health has been recognized as an inalienable right or fundamental right of an individual all across the globe without probably any exceptions. So whatever principles we are going to discuss as part of this module, you can very well apply it to any of the jurisdictions. What would be the outcome of this particular module? Well, if you ask that, I would simply say in one sentence, you can understand the interplay between health and law through this particular module. Obviously, as a novice, one can ask me, or I often get this kind of a questions. They do ask me how law can play a role in determining individuals' health. Because health is something very personal to me, which I have probably got from my genes or genetics. So how by changing law or by bringing better laws, how my health can be, what you call as improved. This is what people ask. But soon, you in the first part of the module itself, you would realize, ladies and gentlemen, that there is inseparable linkage between health and law. But I would try to be as non-technical as possible in my deliberation so that you can understand very clearly and distinctly the existing linkage between health and the law by pursuing this module. To whom this module is useful? That is yet another question. You may possibly would like to verify whether this module would help you. I have identified 4 categories of people to whom I believe firmly this module is going to be very helpful. If you are a would-be lawyer, or you can say you are a law student, having some kind of an inclination and interest in knowing about health law, then this is a module which would give you some kind of appreciation level of idea. If you are a lawyer, a professional lawyer who is interested in specializing in health law or public policy lawyering, specifically with regard to medical law or health law, then I would say this module would help you immensely. And if you are a healthcare professional, including a doctors, this module is of some relevance to you. It can really help you in deepening your understanding of individuals' right to health. And other audience who are interested in knowing about interlinkage between health and law, who they could be. They could be policy practitioners, or they could be judges, or they could be anybody who is interested in knowing about this interplay. This module would be of some relevance and help to them. Let me now briefly introduce you to the whole module and give you some kind of what I call as bird's eye view or 35,000 feet eye view, so that you can understand the scope of this particular module. Undoubtedly, health is an important and inevitable component of life and of critical importance to every living being, not just to a human being. See, you all, I'm sure, even without undergoing any formal education, I'm sure you understand the importance and criticality of being healthy. Just imagine when you had fallen ill or when you are feeling little feverish, or you had a touch of cold, how difficult it is for you to concentrate on your day-to-day moorings. You probably would feel very lazy. You probably would feel rejected to do any work which otherwise with great amount of agility you do in your day-to-day life. So that is one instance by which I can draw your attention, ladies and gentlemen, to the importance of health. Unless you are healthy, you won't be very productive. You won't be able to do your job professionally as they are expected to be done. So, when you really reflect this analogy to the entire society or a nation, which comprises of so many billion of us, then if majority of us are not having a healthy lifestyle, if we are not really enjoying a good possible health, then it would reflect upon the health of the nation. And then it would probably galvanize into negatively impact the total nation's outcomes and GDP, so on and so forth. That is why we just start initiating our thinking and say it is the outlook of everybody. Should be the outlook of the society to see that its members are healthy. Now you can say the modern civil societies are represented by a structure called state, and it obviously becomes the state's responsibility to see that the individual's health is maintained. It's a subject's health is being maintained. Therefore, every legal system considers health as an important component of life and declares it as a basic human right. This is a point which you would probably get to understand very clearly all through this project. This is one particular statement. As we go along, you would find, ladies and gentlemen, I would be repeating as many times as possible. Almost all countries, including India, consider health as a fundamental right. And I'm sure you must have heard about fundamental rights. Every constitution to its subjects confer fundamental rights. Fundamental rights are only declared by the constitution. This is how it is taken. And by, being born as a human being, you are born with these rights which are naturally given to you, and what your constitution does is it only recognizes them, and the corresponding duty, as you all know, would be upon the state. Therefore, I would say we can commence our dialogue by saying health and law are interlinked, because individuals' right to health is been recognized by many of the constitutions as the fundamental right. This is a flow chart which you can see on your screen. It clearly says, on one hand you have an individual, on the other hand you have a state, and it is the responsibility of the state to work towards the safety and welfare of the individual. That is the interlinkage which is otherwise also, I believe, is known by you. That is how state acts as my quasi-parental authority. It tries to always ever endeavor to protect my interests and further my welfare. And it does, it's for that purpose, for the purpose of doing welfare of everyone, it has got enormous power, and that power it exercises subject to the constitutional mandates. And one of the constitutional mandate which we are currently focusing, you remember, is a right to health of an individual. And if you come to the other part of the flowchart, individual enjoys, that is health as a right. He enjoys that particular right. That is where I kept on saying, and I'm going to repeat this also a few more times in the near future till you are taken to the end of this module, that individual has got a fundamental right to health. The corresponding duty of this right falls upon the state. This is where we try to clearly say two things. The first one, because it is declared as a legal right, because it is declared as a constitutional right, we try to give this particular right a glaze of law. And number two, it also tells you how state owns the state actually takes the responsibility on its shoulder to see that its subjects enjoy a better attainable standards of health. This is what we are going to now further discuss by drilling as deep as we can all through this module. Let me now take you a little to the conceptual understanding of health. Well, I don't really know how much of time and energy one should really spend in understanding this particular concept of health. You remember a while ago, I was telling you, every single individual or a living creature for that matter understands how important it is to be healthy. Because ill health actually restrains you, hampers you, so that you feel totally dejected. You lose your enthusiasm. So I don't really know as a teacher how much time and energy we should spend. I believe we can quickly try to wrap up our discussion, come on to the same page, and we try to proceed further. If I may draw your attention here to WHO's preamble, World Health Organization's preamble, it defines health as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. It is probably one of the finest what you call as expressions of health. Here they are talking of one thing, that is a state of complete physical, mental and social well-being of an individual. This is a positive part of it. And the later one talks about the negative part of it. It says not merely the absence of disease or infirmity. So an individual cannot be taken to be very healthy or leading a healthy life if he is not contacted with any of the disease or infirmity, like a person who is not caught, let us say, cold, the person who is not suffering from dengue, the person who is not suffering from fever. You can't simply take him or you cannot take him to be very healthy unless he is really enjoying highest possible standards of health what he could attain. That is where they are trying to bring three very important perspectives. Ladies and gentlemen, it is about physical health, it is about mental health, and it is about social well-being. When all these three things are combined together, you can possibly say a person or an individual is enjoying a good health. So the point of interest at this point in time, or the very important point that needs to be taken note at this point of time, I would say, is when you have taken this as the definition of health, then the corresponding duty lies upon the state. Well, we will come to that particular aspect of duty of state, how state shall endeavor to ensure this particular right of mine. As it is being expressed by WHO, we will come to that in a while's time from now. If considered carefully, I always say, it clearly lays out the parameters by stating that the duty of the state shall encompass preventive, promotive and curative aspects of health services. These are the three very important things. Preventive and promotive, I would call them as public health aspects of your health, and the last one is curative aspects of health services, talks about the curative or the private aspects of health. Anyway, you need not have to really worry much about that right now, because we would get a considerable time in this module to discuss about that little more deeply as we proceed further. Before I actually go to the next phase of our discussion, I would like to recognize the WHO's expression, which actually says, to a large extent, factors such as where we live, the state of our environment, genetics, our income and education level, and our relationships with friends and family all have considerable impacts on health. More commonly considered factors such as access and use of healthcare services often have less of an impact. So they generally call it as determining factors of health. How a person can lead a healthy life, if this question is asked squarely, the answer is little complex to give. It is not the kind of physical strength and genetics, etc. you have. The social determinants of health also become equally important. The kind of environment, clean and green environment if you are living, probably you enjoy a better health. And if you are living in a very dirty and spoiled environment, you are probably not enjoying the similar kind of health standards, irrespective of robust genes what you must have inherited from your forefathers. Well, I can just take sort of a small cue or example where WHO recognizes in its recent document that one of the causes of concern for human morbidity today is the spoiling urban environments, especially the unhealthy air which we all are breathing in our urban centers. So this is what I am trying to really tell you. This is how WHO says there are multiple determining factors to the health. So I was talking to you how there are different determinants of health. Now, if you spare a minute and try to look at this complex, flow chart, it tells you how health outcomes are a resultant of multiple factors. It is about particular flow chart, talks about genetic, social, and environmental factors. And they have further divided them into three groups. One is behavior, second one is fitness, and the third one is outcome. And you just see whatever aspects you have with regard to behavior. Like diet would determine the kind of a healthy lifestyle you live, physical activity, smoking, alcohol consumption, so on and so forth, the kind of stress you undergo in your life. These all are related to your behavior. They had a direct impact upon the health outcomes. And then you have a fitness, like your motor component, cardio-respiratory component, muscular component, metabolic component. This is all what is basically, your constitution. So it to a great extent determines the kind of health you enjoy in your life. And then ultimately, as I said, social determinants of health or environmental factors, when they multiply with this, ultimately your health outcomes would be determined by that. So once again, let me pause here for a second and tell you, when you are talking of these many issues, how law and policy can better your health outcomes is a question we are trying to address here through this module. Let us straight away come to the most important or the central part of our discussion. When I'm talking of health law, you can understand that the corresponding duty, this is what is already known to you, at least I can repeat, the corresponding duty of individual right to health lies upon the state. And state shall attempt to realize a better possible health standards for its subjects. This is what so many times we have repeated, and so many times you have heard me saying that, and I'm sure it has sunk in your mind very well. So when I'm talking of that body of knowledge, which is a health law, it attempts to create an architecture or a legal framework which comprises of the following, you can say, the 4 points. The first, health law, it recognizes clearly the right of the subject to a health. That is, unless there is a right recognized in an individual, you can't start the discourse of law. Now the individual has the right to health, and the corresponding duty lies upon the state and elsewhere. That is the first kind of a legal framework we are talking. and to mandate the state to undertake various activities to ensure health. There has to be a positive mandate for the state to take various activities, programs, and prepare policies so that an individual can enjoy a better health. Mandate of public health initiatives to be undertaken. Like, it is not sufficient that I have a very robust or inherited robust genes. I must also have a good environment to live. So to harness and make most of this, whatever the constitutional benefits I have, I must have a cleaner and greener environment. So where from this cleaner and greener environment would come? So there are a good number of environmental laws. Say for example, my work environment should be conducive so that I can feel healthy, I can lead a healthy lifestyle. And that is where labor and industrial laws would come. And empowering the state entities to exercise sovereign powers to ensure better health standards. Suppose you imagine there is a person for some reason, obvious reason, is suffering from some sort of a communicable disease. At that time, the state should be empowered so that the person can be quarantined, the person can be treated appropriately till he gets out of his morbid state so that he can join back the mainstream. Otherwise, he would be a potential danger to other people with whom he is interacting, who is otherwise healthy, may get contacted with that particular flu or that sort of a morbid condition because it is communicable disease. So there is law does, to empower the state to take necessary actions. Examples I can give is of Public Health Act, Notifiable Diseases Act as it prevails in some other jurisdictions, and even your municipal laws, provide ample space and power to the state agencies to act to maintain better public health standards. And finally, there are other miscellaneous activities like health finance, health insurance, ethics in medical treatment and management and things like that. Law plays a critical role. So if you really look at these 4 points, you can able to visualize in front of you when we use the expression health law, what kind of an environment or architecture we are talking about. So this is a branch of law, and this module will probably, acts as an entry point to understand the greater nuances of health law. Whenever I get opportunity or when I get into my classroom to teach about this, I divide for the sake of easier conversation or for the easier understanding. I divide the entire health law into 2 spheres or 2 categories. First one I call it as public aspects of health law, and the second one I call it as private aspects of health law. And this particular flowchart, which you are seeing on your slide or screen, would help you in understanding the expression public aspects of health law. It is the legal framework which ensures better health standards to an individual by defining the rights and the duties of everyone, including the state. That is what we are currently focusing upon and discussing upon. The remaining part, we may probably not get any opportunity to discuss or focus in this module. Maybe you would probably get some kind of an idea at this moment in time. When I say private aspects of health law, it is dealing with a legal framework, or it is a legal framework which deals with the legal relationship that exists between doctor and patient and various other related aspects. So the first one is regarding the framework, where you are enabled to bring justiciability to the right which is being conferred upon you or recognized in you by the Constitution, namely right to health. The second one is when, unfortunately, touch wood, when you have fallen sick. At that time when you go to get some kind of a curative services, how your rights and how the duties of the person who is providing you the medical care are determined is a private aspect of health law. This is how you can keep it in your mind so that you are better able to contextualize our discussion. Well, let us continue little further. Now, when I say individual has got a fundamental right to health, I need to elaborate and establish this factor little more clearly. The time has come. I should refer you to some of the documents and tell you how your right is being established or recognized. And they say the highest attainable standard of health is being recognized as one of the fundamental rights of every human being. This is what we were talking. This is where we were discussing, and you were already introduced. It is not absence of disease. It is the possible highest attainable standard of health. And WHO in its preamble imposes a positive obligation to every nation state to contribute to the health of their people and their obligation, and also state that this is not imposed from outside but follows from the fundamental rights of every human being. So don't think just because Constitution reads into itself your right of health, that doesn't mean the Constitution has created that right. This right you are born with, and Constitution or a legal framework only recognizes that right. We can make a passing reference here to a WHO in its framework, which monitors the actions of every state regarding the health promotional activities, including its regulations, policies, so on and so forth. And in India, the traces of the right of health are enshrined in our Constitution. And maybe I will quickly take 1 minute before I draw your attention to our Constitution and we learn about our Constitution's articulation regarding your health to various international documents. I have just illustrated 4 very important human rights documents, 4 important documents, international documents. They are Universal Declaration of Human Rights, International Covenant on Civil and Political Rights 1966, UN Declaration on Elimination of All Forms of Discrimination Against Women 1979, and the Convention on the Rights of the Child 1989. These are the 4 prominent documents. If you read them through, you will find the glimpses of individuals' right or your right to health is being categorically recognized there. So, internationally, it has been recognized as a human right. Now, without spending any further time, ladies and gentlemen, I seek your leave to introduce you to the specifics of our Constitution. Well, I must start by saying, unlike many constitutions elsewhere, I can illustrate or take the example of South African Constitution, which has got a very specific provision in itself, express provision, which declares health of an individual as a fundamental right. But we don't have any specific express provision in our Constitution. Well, let me also say that it doesn't mean when I said you don't have a specific written, provision which declares individual right to health as a fundamental right, doesn't mean our Constitution does not attach importance to an individual right to health. It actually appropriately emphasizes, let me put it that way, the individual's right to health. Whatever courts, the constitutional courts, while interpreting the Constitution, wherever they got the opportunity, have read right to health as fundamental right into Article 21. And you all know, needless to mention, I suppose, Article 21 deals with the right to life. And it is one of the integral parts of right to life. And there are a good number of instances where both Supreme Court and High Courts have not only read right to life into Article 21 of the Constitution, but have pushed the state to respond positively to bring better justiciability to the said right. But the activity that needs to be done, maybe feeling empowered, if at all you feel empowered by studying this module, the question you need to probably ask in future is, yes, as an individual, there is a recognized fundamental right to my health. But can I enforce it against the state? what is a facilitating sort of an environment that has been created in India where I can actually bring justiciability to my right. That evaluation would make you an aware citizen. That is what I wanted to say before we proceed any further to conclude this module. Well, I was while ago, ladies and gentlemen, referring to some of the constitutional judgments where your right or a fundamental right is read into Article 21, making it as a constitutional right. Let me take this opportunity to very briskly run you through some of the important judgments. Well, there are innumerable number of judgments which can be quoted here, but I have kept myself to a bare minimal, judgments which I thought are very important articulations or expressions. In state of Punjab and another versus Mohinder Singh, the Supreme Court has observed it is now a settled law that right to health is integral to right to life, and government has a constitutional obligation to provide health facilities to its subjects. So in a very clear and simple way and a straightforward way, Supreme Court has said the government has to take on its shoulder the obligation to have a better healthcare facilities so that the individual's right to health is protected. You see, the Gujarat High Court in one of its milestone judgments observed health as a basic human right should be viewed holistically and its positive aspect, that is, well-being should be acknowledged, which would lead to achievement of socially and economically productive life. Another Orissa High Court judgment, the citation and other details you are seeing right away on your screen, where the court observed, life is a glorious gift from God. It is the perfection of nature, the masterpiece of creation. Human being is the epitome of the infinite prowess of the divine designer. Great achievements and accomplishments in life are possible if one is permitted to lead an accepted healthy life. Health is a life's grace and efforts are to be made to sustain the same. They further continue and try to impose the relevant duty upon the state so that a person can attain the possible healthy lifestyle and possible attainable standards of health. Well, it is not the end of the matter. It is not just Article 21 which includes in itself the right to health as your fundamental right. There are other constitutional provisions to which we can make reference to, which would put the state on a positive duty. Especially, I would like to draw your attention to few of the directive principles of state policy. Well, friends, directive principles of state policy do not give you the direct right to enforce or hold them against the state, but they are considered to be guidelines to the state whenever it formulates a policy, whenever it tries to create a program for the welfare of its subjects. It has to always keep in mind these directive principles of state policy. Let me draw your attention to Article 38. It states, state has to secure a social order for the promotion of welfare of people. Welfare being the one which covers the health of people must be ensured by the state through its actions and policies. You take Article 39. It states that the health and strength of workers, men and women, and the tender age children are not abused, and that citizens are not forced by economic necessity to enter avocations unsuited to their age of strength. Article 42, for instance, provision for just and humane conditions of work and maternity relief, the state shall make provision for securing just and humane conditions of work and for maternity relief. Finally, without taking much of our time, I would refer you to Article 47. It states the duty of the state to raise the level of nutrition and the standard of living and to improve public health. The state shall regard the raising of the level of nutrition and the standard of living of its people and the improvement of public health as among its primary duties, and in particular, the state shall endeavor to bring about prohibition of consumption except for medical purposes of intoxicating drinks and of drugs which are injurious to health. The combined reading of all these provisions, which I just now referred to, would tell you how the state has been asked again and again to formulate its policies and roll out programs so that the individual can not only attain the highest standards of health, but he can also be benefited and he can also benefit the society at large because he is enjoying a better health. Well, coming back to the point with which we started, having accented sufficiently the role of the state as far as health is concerned, you can always say, this is what I am showing you on the screen. A state has to constantly involve itself at three levels in discharging its duty towards individuals' right to health. That is, I have said preventive strategies it has to evolve, promotive strategies of health it has to evolve, and then finally it has to develop curative strategies also. But before I proceed any further, I just would like to take few minutes, maybe less than 2 minutes, to tell you when I am talking of preventive and promotive strategies, it is what the WHO's definition we studied, or the aspiration that we are not only talking about a person who is fallen sick, is treated or is been given some kind of pills and medicine. We are talking of a scenario or a situation where a person doesn't actually fall sick at all, or the person can possibly attain the greatest level of a health which he can otherwise enjoy. How state can endeavor, how state can include itself into that kind of an activity. They are referred to preventive strategies and promotive strategies. Finally, all of us, howsoever good health we all may enjoy, once in a while we fall sick. At that time, how I can get myself out of morbid condition, how I can get some kind of a necessary medical assistance. That is where the curative strategies would come. So far what we have done, let me, before slip on to the concluding parts of our discussion, I wanted to just very quickly wrap up, if I may, ladies and gentlemen, as to what we have discussed so far in this module. If not more, we have today understood why and how law and health are interlinked. This interlinkage we could understand. Number two, we have also by this discussion so far have understood how an individual is conferred with the right both under international documents, how it is recognized as a human right and how it has been recognized as a fundamental right in our constitution. This is what we have understood. So on one hand you have an individual who is conferred with the right of a health and the corresponding duty to involve itself and devise strategies of preventive, promotive and curative lying upon the state is what we have understood. Now, from this descriptive part of the module, let me quickly slip to the analytical part of the module. Well, you may always ask, having a person who has invested your time, you may very well ask, yes, I have understood the discussion. Sir, whatever you have explained, I have understood. But what is the application value of this? That is a very important question nowadays every learner is asking. It is not for mere knowledge, but how this knowledge I can actually use. That is where the analysis would come. I always say, look, it is not sufficient we declare on papers the individual right, but how that right is capable of being enforced. What kind of a congenial environment we have created where an individual can enforce his right. That is where some part of evaluation becomes essential. When I am saying evaluation, you evaluate in India what kind of justiciability we have to our right. That is what we would be doing before we conclude and bid goodbye to each other through this module. These are the current issues of debate. If you just quickly glance to the flowchart which I have put on the slide, you will find increase in allocation of healthcare, bringing back the focus upon preventive and promotive care, greater access to healthcare, especially to the poor and deprived and downtrodden members of our society, improving the productivity of public spending, and financing the healthcare are very important global issues, on the basis of which you can evaluate the justiciability status of every individual's right to health. What we would do now is, we would take each one of these elements separately and try to apply and evaluate it in Indian scenario. Let us talk about the healthcare allocation. Allocation in terms of, money spending. The national policy 2017, that is National Health Policy 2017, aims to increase the government spending from 1.5% of GDP to 2.5% by 2025. What does it mean? Look, we are currently spending less than 2% of GDP on health services or health sector, which is awfully negligible or less. And rightfully, the current government is today talking of increasing it gradually by 2025 to 2.5%. What does it translate into some figures? I would say it is estimated by certain studies that the government's total allocation should reach to INR 800,000 crores by 2025. Then roughly we would be reaching the target of 2.5% of total GDP. And this particular 800,000 crores, mind you, is a total spending by central government as well as state governments together. And well, you contrast that to what is the present spending. We are spending about 200,000 crores presently. So, how much we need to augment our resources to reach that 800,000 crores, I don't really think I need to assist you in calculating, because it's a simple math. Now, let us take how much was in the last budget we allocated for health. It was around 52,800 crores. So around 53,000 crores, if you really take it and contrast it with the last budgetary spending, I don't really think it is a long distant dream for us to attain 800,000 crores by 2025. So, although we are talking of increasing our spending to health sector, or to bring better justiciability to individual right, or respecting the individual right to health, we have a long ground to cover. That's the point I wish to bring to your notice. So you can evaluate on that ground how our governments are prioritizing health as one of its important, what you call as priorities. Second, focus upon preventive and promotive care. There is a concept, I often get attracted by this concept. It is called value for money, that is VFM. Like you have 1 rupee or a very limited resource which you want to spend on so many things. That is what I am sure if you are a student of economics, you are told by your teacher. You have a very limited resources and you have unlimited wants. So you need to prioritize on which you want to spend. There, ladies and gentlemen, coming back to the health sector, which is our focus, how government can generate more VFM, that is value for money. If you really look in, if you are spending 1 rupee for preventive and promotive sort of, let us say, strategies, you can benefit more number of people and you can make your people more healthy is what public health strategies and studies tell you. But for certain obvious reasons, today's governments do not want to put their money into the preventive and promotive pocket, but they wanted to spend more on the curative part of it, which is a very expensive and it is an individualized spending. Let me explain it very simply. If a government establishes a super specialty hospital, yes, no doubt there are so many people who are going to be benefited by that. Because if you are in a need of that kind of a curative care, you would access that hospital and get your cure. But it is few individuals who are going to really get benefit out of it. But if the same amount of money, if you try to invest in preventive and promotive aspects of health, then probably you are saving so many people falling sick and needing those kind of a curative services. Let us take another very simple example. There are a lot of waterborne diseases. There are a lot of vector, borne diseases for which people require curative services. Curative services, as I said, are individually benefiting, are individually oriented and very expensive. But if you try to eradicate spread of vector-borne diseases, and if you try to really provide a better, potable water to its subjects, probably we would be preventing your subjects falling sick and then needing for some kind of a curative treatment. But for obvious political mileage, governments are today more eager to spend on curative, aspects of health rather than preventive and promotive. That is another very important point on the basis of which a civilized society and an aware citizen like you can evaluate your government's policy and their, seriousness. Healthcare access to the poor. This is continuing to be one of the very important aspects as far as India is concerned. Here, I just would like to make a passing reference that healthcare access in case of emergency, thanks to Supreme Court judgments, two of its judgments, we could by and large implement it. So if you are suffering in an emergency scenario, if you are victim of an emergency, without really worrying about the paying capacity, depth of your pocket, economic ability, so on and so forth, you are entitled to receive some kind of, let us say, healthcare services. However, access to healthcare to the poor still continues to be a big challenge. Well, Ayushman Bharat health insurance scheme, which has been announced by the present government, is a very ambitious plan and it envisages to be the biggest government-sponsored healthcare scheme in the world, which would ultimately benefit more than 50 crore citizens. But still, we have to wait and watch as to how this particular Ayushman Bharat scheme would unveil itself and try to provide better healthcare access to the poor. Well, it has not been put on the slide here, but I wanted to actually tell you, people who live in remote, inaccessible places of India still find difficult to access healthcare establishments to get healthcare services. So it's going to be one of the important parameters upon which we need to work. Improve the productivity of public spending. No doubt, one is we in the beginning spoke about 800,000 crores, which we are aiming to augment or we are aiming to spend by 2025. But before reaching there, if you really, year to year spending, there is a constant increase. Every budget would allocate more and more money than the previous budget for, health sector. But are we really generating that kind of proportional, what you call as improvement in our health services? The answer, unfortunately, is no. And we must also understand the state is today not investing in its own, healthcare framework or healthcare investment, institutions. There are studies which indicate nearly 70% of the healthcare in India is being provisioned or provided by private players, and government has rolled back to have only 30% share. So every money which you are spending, the increased spending or budgetary spending to the health sector is probably going into the greedy pockets of some of the private entities. So this is definitely going to have some kind of an impact as far as the ecosystem through which you are trying to bring justiciability to individuals' health. Now we will take healthcare financing. Let us, without getting into the theories, studies, models and things like that, I try to really ask a very simple question. Healthcare is so costly, it is skyrocketing. And even some of the upper middle class society today feels completely shattered if somebody falls sick and require a major surgery. Some of the members require a major surgery and they have to take a longer duration healthcare services. And there are good number of what you call as documents which indicate increased healthcare costs is being identified to be one of the major causes of poverty in India. So at that point in time, how are you going to really bring a public finance or for that matter insurance as a financing option so that people feel secure? This is one area where there is very little studies and very little that has been done in India. And obviously this is going to really determine the outcomes or individual's right justiciability of his health. So what we have so far discussed, ladies and gentlemen, is not only how health and law are interlinked, how as an individual you have that so-called theoretical right to your health, and how you can evaluate it to yourself, how far your right is enforceable, and how far you have a congenial environment to see that your right to health is enforceable. And on the basis of this, you can critically evaluate any policy, any program of the state. This is what I think we have learned today, and that is definitely going to really kindle your further interest into the area, and you can possibly develop some kind of let's say self-interest in the area, and you can study. Thank you very much.